This presentation is a recording of the Vortran IPPB. I'm overdubbing it because my sound microphone didn't pick up on the soundtrack. What I'm showing right now is the Vortran IPPB, sometimes known as the Piper, and we're going to show you how to use this thing. Okay, what you're seeing displayed on the board right now is normal breathing versus two types of IPPB, the bird IPP and IPPB, or intermittent positive pressure breathing with the Vortran. The purpose of it, of course, is to turn collapsed alveoli or atelectatic lung into non-collapsed or recruited to either treat or reverse atelectasis. Now, normal breathing, you inspire and create a negative pressure, a slight negative pressure to inspire, and a slight positive pressure when you expire. The bird IPPB is different in that the entire, you create a small negative pressure to start the machine or to activate the machine, and then throughout the inspiratory cycle you have a gradual rise to the set inspiratory pressure, and then when that's reached, the exhalation valve opens and you cycle into expiration until the next positive pressure breath again. The Vortran works very differently in that the positive pressure is created on expiration as you blow out into the machine. You create a slight negative pressure as you inspire, and then when you expire there's a positive pressure. So it's a very different way to create positive pressure than the bird IPPB, but still considered volume expansion therapy or hyperexpansion therapy. Okay, what you're seeing in front of you now, again I'm overdubbing this, is the Vortran, and I want to take this apart and show you each individual part separately. First thing I'm going to take off here is the nebulizer, and what I'm going to do is unscrew the nebulizer and show you where the medications go. This is where the medication goes. It creates a distinctive sound when the nebulizer is running. The device inside spins and you'll be able to hear a particular sound. The next part I'm showing is the device that actually makes the Vortran work. And what this basically is a spring-loaded valve, and when you blow against it you have to overcome a particular set pressure in order to hear the valve snap and open and allow the patient to expire. This is exactly how the positive pressure is created as the patient exhales into this device. So it's important that you tell the patient to keep the, and now what I'm showing here is you can dial in the pressure that you want based on there we go. You can dial in the pressure. That would be 20 there, and then from 20 to the gray ring is from 30 to 40. Now next I'm putting in the pressure gauge in line so that you can see when the patient exhales against it, you can see how much pressure rises. That's what I'm going to show here. Right now, as I blow against it, I'm getting a pressure of 20. Now if I reach over and turn up the pressure, let's see what it is on the new pressure. Now as I blow into it, it's rising all the way to 40, as you can see. The part that I'm pointing to now, you don't need to use for intermittent positive pressure breathing, but you can use it if you're using this as a portable ventilator. Now I'm putting the entire device back together. First, the water trap in place. Don't think it's where you put your medication. The medication doesn't go in there, okay? And the Vortran, the nebulizer part on. Try to keep your fingers off the mouthpiece. So when you set it up for a patient. And now we're going to show you how to use the device. The opposite end of the tubing will be connected to a flow meter, and the flow meter will be set on. With it connected to the flow meter outlet, turn your flow up to 15, and then above 15 you can stop where the ball just touches the top, and that'll be about 20 liters per minute. If you continue turning past that point, you can go as high as 30 or 40 liters per minute. The problem with doing that is the nebulizer with the medication runs out in less than a minute. So even at the flow, now one thing you got to realize about this nebulizer is the nebulizer will only run above about 12 liters a minute. Below that, the nebulizer won't work. But at between 15 and 20 liters a minute, the treatment only lasts about 2 minutes. The best compromise that I can think of is to go ahead and run the first 3 minutes of the treatment at between 15 and 20 liters a minute, so you maximize medication delivery. Now, if you look carefully, you can see that I have the device turned on, and I've got it about 15 liters a minute, and you can see it starting to nebulize and put out mist. Again, this is only going to last, the medication that is, a 3 cc treatment is only going to last a few minutes at the most. So don't run the medication at flush or on a 50 psi outlet, or it won't even last a minute. A compromise might be, and you'll have to check with your facility's policies, but a compromise might be to put 2 unit doses if you're going to run it at flush for the first few minutes of the treatment. I would recommend running the first 3 minutes of the treatment at between 15 and 20 liters a minute to maximize medication output. Be sure to tell your patient to keep their mouth on the mouthpiece and to exhale into, and as you can see, as I exhale, the pressure rises on the gauge, and you should encourage your patient to exhale into the device, and you should hear that valve snap when it clicks into exhalation positive pressure. The medication will start to sputter as it runs out, and the nebulizer will change pitch. This will be after only a few minutes of running the treatment at between 15 and 20. Finally, this is what I'd recommend. Connect your output for the first few minutes of the treatment between 15 and 20 liters a minute. Any less than that, it's not going to nebulize. After the nebulizer sputters and changes pitch, then you can switch it to flush, which is probably between 30 and 40 liters a minute. Have the patient, here's the patient's mouthpiece, have the patient blow out into the mouthpiece and watch the pressure reading on your gauge here. This is controlled here. This is not used for the treatment. And the total treatment, again, check with your own facility's policies, but the treatment would probably be at least 10 minutes, possibly 15. It might not be unreasonable to double the amount of medication here if you don't think that the patient's showing a benefit from a 2-minute or 3-minute bronchodilator treatment. Because after all, it's not the amount of medication in the cup, it's how much the patient gets in their lungs. And if the treatment is only lasting 2 minutes at 20 liters a minute and you don't feel like that's benefiting the patient because they're still wheezing, you might talk to the doctor or talk to your supervisor and have your policy revised. And that's all I have to say about this. I hope you learned something. I know I did making